Hello. The PPE that I'm wearing, the personal protective equipment, is equipment to be worn to minimize exposure to hazardous materials that might cause serious workplace injuries and illnesses. These injuries and illnesses may result from contact with a chemical, radiological, physical, electrical, mechanical, or other workplace hazards. The gloves that I have on. Gloves help protect you when directly handling potentially infectious materials or contaminated surfaces. The gown that I am wearing, gowns help to protect you from the contamination of clothing with potentially infectious material. Head covers, you can't see the other one that's underneath the other one, but and I don't have the shoe covers, but the shoe and head covers provide a barrier against any type of possible exposure within a contaminated environment. Mask and respirators. Surgical masks help protect your nose and your mouth from splatter of bodily fluids. Respirator filters the air before you inhale it. Goggles, which are underneath the face shield. Goggles help protect only your eyes from splatters. A face shield protects splatter from the facial, skin, eyes, nose, and mouth. Okay, so next, the fun part. The solution that I have in the sink right now is actually water and bleach is what I'm going to actually decontaminate the surgical instruments with. The first instrument that I have, which has actually been placed in strawberry balsamic dressing, and this is actually a pull suction tip. So this pull suction tip is an instrument that is used to remove large quantities of fluid from surgical sites during procedures. It is often used during abdominal procedures. The pull suction tube has multiple holes. I'm not sure if you can see, but it has multiple holes in there. And this is to best prevent blockages caused by fat or tissue suction during a procedure. And the detergents that you would want to use to clean this type of pull suction tip would be a scalar detergent and enzymatics, which are very good to use to actually decontaminate this type of instrument. The next instrument that I am going to decontaminate, sorry, really going to have to decontaminate this one because it's clearly stuck to the paper towel. This one is actually contaminated with a stir fry dressing, and this is a Metzenbaum scissors or a Metz, and it is used for fine dissection and cutting. They're most frequently slightly curved. As you can tell, it's kind of curved. And these scissors are used to incise the deep rib bed periosteal layer, but they stay extra plural. And what is good, a detergent that is good to use to decontaminate this type of scissors is a multi-enzymatic detergent. And the next instrument, the forceps, and these are tissue forceps, and this was actually put into a jar of jalapenos. And these surgical forceps are good for, of course, grabbing tissue. The tips do have teeth to securely hold the tissue. Typically, tissue forceps are designed to minimize damage to biological tissue. These forceps are used for delicate tissue handling and traction during a procedure. And the detergent that you would want to use to actually clean these would be neutral pH or mild alkaline detergents. And last but not least, the snit tonsil forceps. And this was actually dipped in, oh my gosh, maple Dijon dressing. These tonsil forceps help doctors to remove tonsils when they cause infections or breathing problems. Surgeons use these forceps to clamp the soft tissues of the tonsils to reduce bleeding. The handles are very light and have wide finger rings to increase your control and dexterity. And what you would want to use, the detergent that you would want to use to clean these would be pH detergents to clean these. And last but not least, since I have everything cleaned, what should be done immediately after cleaning your instrument? Well, of course, you've already prepared. You've basically already cleaned everything. Next will be the sanitizing, which we'll be going to next. And then the sanitizing part is what would actually kill all the bacteria that are on the instruments. And then we would basically start air drying. And then after air drying, we will package all our instruments and get them ready to go.